Hello and welcome everyone. My name is Eddie Bartnick and I'm the International Lead for the International Initiative for Disability Leadership, or affectionately known as IDL, and I'll be your host for this discussion. I want to start by first acknowledging the First Nations people of the various lands in which we're meeting today, and for me they are the Whadjuk people of the Noongar Nation here in Perth, Western Australia, and to pay respect to elders past, present and emerging. I'd also like to welcome our two guests, Jennifer Johnson, Deputy Commissioner with the Federal United States Administration on Community Living, and Charlie McMillan, Chief Executive of the Scottish Commission for Learning and Disabilities. So a very warm welcome to you both. Today's topic is strategies to overcome COVID-19 as an inequality multiplier. It's part of a series of COVID-related discussions being held by the sponsoring country's leadership group of IDL, and both Charlie and Jennifer are key members of this group comprising 8 member countries. I know they have strong passions and are keen to share their views on this topic of inequalities. This is going to be a short, sharp and informal interview to scope the key aspects of this topic and set the scene for our country member discussions. So Jennifer, I'd like to start with you. So welcome. And our sort of first question is, from your perspective in the United States, how have you seen COVID-19 act as an amplifier or multiplier of existing inequalities experienced by people with disabilities?
Well, first, I want to thank you for inviting me to this virtual chat. It's always good to connect with international colleagues, and I know COVID is still front and center for many of us as we continue to address the pandemic and the needs of people with disabilities. I think for me, one thing that is true for any kind of emergency, whether it is a natural disaster or a public health emergency, is that people with disabilities always feel the impact much more than others. And we've seen COVID-19 has been really no different for people with disabilities. We all know that they face greater health risk from COVID. They're also at increased risk for social isolation and food insecurity, and experienced for us here in the US, a lot of significant disruption to the community-based services and supports that they rely on to be connected and live in the community. They were also amongst the first to lose jobs and are amongst the last to get reconnected to employment here in the US. And some of them have lost their housing or have been at risk of going back into an institution because of housing issues or economic security issues. And now we're seeing that people with disabilities are having access issues with vaccines. A recent report by our Centers for Disease Control showed that even though vaccine hesitancy is low among people with disabilities here in the US, the vaccine rates are lower than the national average, which highlights the barriers that many people with disabilities are facing in even getting a vaccine. And when we look at this through an intersectional lens, the challenges are even further exacerbated. So in the US, minority communities have been hit harder by the pandemic. And so when you intersect disability with other forms of marginalization, the challenges just further multiply for those individuals. But one of the things that we've experienced here in the US is that COVID has really brought to the forefront many of these disparities, many of the disparities that we've all been aware of for years and have been working to address. But it's been much more in the forefront here in the US. And there's also been greater recognition of the importance of the formal and informal supports that people with disabilities rely on to live in the community. It also brought forth to the forefront the risks of institutional settings, and that being in the community is a better and healthier option for people with disabilities. And the other thing that's kind of been revealed through this is that there's much more attention being paid to the need for better data on the disability population, because we haven't been able to track how the pandemic has impacted them as much as we have been able to track how the pandemic has impacted other marginalized populations. So there have been some positive silver linings, but it certainly has brought to the forefront a lot of the disparities that they experience.
Thanks, Jennifer. That was really comprehensive. Thank you very much. Hey, so Charlie, from a Scottish perspective, how have you seen this happening to people with disabilities in your country?
Well, it's actually fascinating, Eddie. Thanks for the opportunity to speak to you today. And Jennifer, I honestly could have opened up almost word for word in terms of people's experience. I mean, we're focusing predominantly on people with learning or intellectual disabilities in Scotland, but absolutely all of those experiences and learning that you're identifying are key issues. In preparing for our discussion, I kind of identified 4 key areas, if you like. The first was access to healthcare, and that COVID and the pandemic absolutely amplified the challenges people with learning disabilities experience in accessing healthcare. And all the way from the use of different scales, which might have limited their access to healthcare, to different treatments, through to vaccine access. We've been engaged and involved with our Scottish Government colleagues, working to ensure that people's needs were addressed on an ongoing basis. We have had some successes, but it has been notable how on a day-to-day basis, access to healthcare is a real challenge for people with learning disabilities. Another huge issue that emerged very early on in the pandemic and stayed with us throughout is access to information, and making sure that information is prepared in formats that are accessible to people. We ourselves became a bit of an easy read centre in terms of the Scottish response to the pandemic, and have produced dozens, literally dozens of documents and guidance, interpreting document letters, etc., ensuring that people can get some access. Now, we've also tried to make sure that that wasn't all digital, because there's a real connection between access to information and the lack of access to the digital world for people with learning and intellectual disabilities. That came to the forefront, so we, wherever possible, were providing things in hard copy as well, making sure we continued to use the postal service, making sure we were getting that information out to individuals through their support providers, or indeed to themselves. And that lack of digital access initially was a huge and significant excluder of people. We have worked, and there's a national programme funded by the Scottish Government in terms of provision of IT kit that's ongoing in Scotland, and we've seen people's skills develop. As Jennifer says, it's not all been bad news. There have been some wins out of it, but there are also those people who will never be able to access the digital world as it's currently constructed, whether through the communication issues that they might live with on a day-to-day basis, or the lack of flexibility in terms of kits. And my final point about access really was the big learning for us about lack of access to communities. Now, I know that was sorely challenged for everybody in terms of the lockdown, but then we realised very early on in the pandemic just how excluded people were from any kind of sense of natural supports, and how isolated they may not live in institutions. And we have over the last 30 years tried to work very hard in terms of establishing people in their communities, but they're not part of those communities. I think that came home loud and clear. And even in terms of making sure they were in receipt of the emergency response that there was quite a challenge, because they were largely invisible. And I think that was one of the significant pieces of learning for us. And Jennifer's point about data collection, I mean, honestly, I would underline that in red. For us, data collection and meaningfully disaggregated data that actually looks at different groups within communities, really, really profound. All in all, Mac, the question I'm left with is about that life lived in poverty and what that poverty did in amplifying the experience for people. And that picks up on many of the points Jennifer again made about intersectionality as well. And it does appear to us that we've got a real issue in Scotland moving forward with people with learning disabilities, a life lived in poverty.
Thanks, Charlie. Boy, we're off to a terrific start. So, so just going forward, I'll stick with you, Charlie. This next question is really around So knowing what we know now, thinking about good preparation and sort of response going forward, like from two levels. One is sort of like more the system policies level, but importantly also the level of the individual person. I think you started to tease that out in terms of isolation, access to community. So if you could share what you think good would look like, both at the sort of overall system level, but also at the individual person level.
Well, at a system and policy level, I really would stress the need for meaningful. We've got a process in the UK called equality impact assessment. And when you're preparing policies and looking at structures, there's a significant amount of thought put into the impact anything that is planned will have on marginalised groups. And specifically for us, people with learning disabilities. That for me, I fear, has been largely absent in the last, 5-10 years or so, in terms of making sure that what we're doing is actually meeting the needs of people who need it most. So I do think there's a wake-up call for, and I have to say we're well supported by the Scottish Government, both as an organisation and as a community, but those in local government, people in health bodies and organisations, and other public sector organisations, they must be thinking about equality impact assessment on an ongoing basis. At an individual level, for me, Eddie, the leadership journey that we've been on in Scotland and the individual leadership journey is so significant. We have to invest in people by way of investing in their leadership skills and making sure that they're empowered and enabled to speak up for themselves, to take their rightful place in terms of all the systems and processes, and making sure that their voice is heard. So it connects both the individual work and the systemic work. And finally, at a community level, I think there's absolutely something about challenging the culture on an ongoing basis to ensure those who are most excluded are considered and seen as valuable members of society. Now that's easy to say and much harder to achieve, but unless we're working from that place, people will just be further excluded, I fear.
That's terrific, Charlie. Thanks for pulling out those two levels, very complimentary. So Jennifer, from a United States perspective, what do you think good preparation and a response would look like, again, at these sort of two levels?
Yeah, so this is a great question, because every time we go through some kind of emergency or disaster, there is this opportunity for reflection and to talk about what we can do differently. And I've had the fortune of working for the US government for 18 years now. So I've witnessed how our country has responded to various kinds of disasters, some of those natural and some of those man-made, and then most recently with this pandemic. And so I've been able to see how things work well and where they don't work well, both at the policy level and then how that trickles down to the impact on individuals. And, looking back at 9/11 and things like Hurricane Katrina, that really was a huge impact to the southern states here in the US. These disasters really brought to the forefront the need to include people with disabilities in disaster planning, because it really made, again, apparent how they're left out and how greatly they're impacted when it comes to any kind of disaster or emergency. And so there's been quite a bit of policy work done to include them. But then we saw with the pandemic, it was just a repeat of what we've seen happen in the past with other kinds of disasters. And each time for me, the effectiveness of the response is based on the ability to coordinate, whether that be at the local, state, or federal level, or across all of those. And so that's, again, what we have policies in place and programs and structures in place, but the effect of those, the ability to implement those is really dependent, again, on people being able to break down the silos and work together. And it's even more effective when those relationships existed before the emergency or the disaster. And the stronger the relationship before the disaster, the better people are able to pick things up and respond to that disaster. But I've also learned the importance of making those connections possible. and the importance of leadership role in making those connections possible. And when they are shut down, it then really limits what we can get done. And so right now we're really talking about how we can support those relationships and connections at the state and local level, because in the US, all responses are really locally and state driven. And while the government has a supporting role to play, the response is really local. So what we're trying to do, again, is use those policy structures that we have in place to facilitate those connections so the right people are at the right table. And that really, again, seems to have an impact in terms of what happens at the system level, and then also how that trickles down to supporting the individual.
Great, thank you. Hey, just a question about this sort of individual level. So, so it seems to me that people are safest when they are known to people and people are in contact and they've got sort of, community supports, but also that the system also has some knowledge of individual, sort of connection to individual people. Do you want to make any comment about any forms of individual support coordination or service coordination or case, those sort of ideas? Yep. I'm familiar with a particular approach called local area coordination, but it's a very connected approach to the person and to their community. So do you want to make any sort of comment on that part of it? Because, no, that's a great observation, because certainly we saw that need early on in the pandemic, and here in the US, we do have the ability to utilize case management in a disaster or an emergency, but it depends on leadership. And leadership recognizing the need for case management and authorizing the use of case management. And in the past, we've been able to, again, utilize our connections to different parts of the government to make the case management happen. But, early on in the pandemic, the leadership just basically wasn't there to facilitate that. And where there's a great need, if we had that case management early on, it could have not only saved lives, but also helped people through the pandemic. And without that in place, we saw a lot of lives impacted that could have been supported if we had that case management in place. And that was something that we were advocating for. But again, it just wasn't, the leadership wasn't in place to recognize the overall need for that. So a great example of where we have the policy structures in place, but without the leadership to facilitate that, it doesn't happen. Yep, terrific.
And those,
sorry,
Eddie, I was just going to say those services for us were some of the first to stop at the start of the pandemic. So local area coordination, for example, fell away as the staff were advised to stay at home, etc. So there's a real challenge about how you keep those supports going in the face of a natural disaster like the pandemic, because I do think it was a huge learning piece for us in Scotland about the urgent need to ensure that the support systems were still happening.
Yeah, and in fact, the opposite happened in England, where they were a key part of the response strategy. So this is very interesting. So, hey, Jennifer, just sticking with you, we've got a couple of minutes each for both of you, just sort of thinking about what lessons you want to make sure leaders take forward in planning, developing policy and delivering services for people with disabilities. So a couple of minutes each. So key lessons, this is framing up the discussion with the country members. What would you like to see taken forward?
Yeah, well, and I just talked about the value of relationships and connections. And so that definitely is something that we take away and are thinking about how do we facilitate those across the federal government, but also at the state and local level. But I think we as leaders know where the gaps are in supporting quality community living for people with disabilities. And those are things that we've been working on for years to address. And COVID, I think, has really created a runway for innovation. And we really need to take advantage of that. We're always looking ahead at the next generation of services that will be the real anchor for sustainability in the years ahead. And I think COVID has given us a window to do that. Really think about what do services and supports look like post-pandemic, if we ever get post-pandemic. And as we talked in the first question, COVID really laid bare all the things we know about services and supports and access issues for people with disabilities. And we really now have the opportunities to ask, how can we use COVID to create change? What are the opportunities for provider organizations in this environment, for policymakers, for program administrators, and for researchers, and even for individuals themselves? And in the US, we've had some infusion of funds into home and community-based services as a result of COVID, and it's giving states the opportunity to think about how they address the gaps that have persisted. For example, with direct support professionals in the US, we've had a real crisis there, and the pandemic made it even worse. But the states are starting to use those resources to solve some of those problems. And then the last thing is that we don't necessarily have to reinvent the wheel. There is research out there, there is innovation out there, some of that was before the pandemic, some of that occurred during the pandemic. And the last point that I want to make is that we must always focus on the person and what the person wants and needs to live in the community, and look at that through an intersectional lens.
Excellent, thank you. Hey, Charlie, your input on the lessons to take forward.
Yeah, no, well, again, very, very similar, Jennifer. I would really reinforce the point that for many people with learning disabilities, the pandemic continues, and we've got a bit of a tension societally as many people try to move forward from the pandemic, whereas others are still dealing with the impacts. Really, we talk in mindfulness about the sacred pause, and I do think there is an absolute need for us to learn from our experiences over the last 20 months, to pause and take on board what we found out. There's been significant research undertaken across the UK, huge amount of learning, NGOs and many other organisations pivoted their business model, completely changed the way they're doing their work, delivering their support. I mean, we now live on Zoom and Teams and WebEx. Some of that is really, really positive because it means we can join up across the country and do some really hugely creative work. But how do we take that forward with us? Because it isn't the answer for everybody. And I do think that policymakers absolutely need to now get close to the research, close to the experience of people, and actually be speaking to them about, well, moving forward, how do we build forward differently, rather than any other phrase that's used. But I know IIDL have heard me speak on that before, but building forward differently is really important, and learning from this experience is absolutely essential.
Cool. Hey, so that's been incredibly valuable, and just sort of trying to pull a couple of things out of that last discussion. So very much a focus on each individual person and learning from people's experience, the sharing innovations and learning and using the data and the experience, using COVID as an opportunity to create change, and most importantly that, you know, at every level thinking about this intersectional lens on both individual circumstance, but also at that sort of policy level. So, so that's been fabulous. So just thank you both of you for your passions and deep insights into our topic today. It's very interesting, Jennifer. So you've got the broad national government view, long-term. Charlie's sort of working more sort of community lens, you know, with people with learning disabilities. The two perspectives have been very, very complementary. So I think they really help us frame our future priorities and collective efforts to ensure that current and future inequalities experienced by people with disabilities are addressed, and addressed well. So much appreciated, and thank you both very much. And